Chairman's Update. Uh, for the past several weeks, we've been going through each of the sections of the 2024 Washington State Republican Party platform that was passed at the state convention in April in Spokane. And we've been going through each section. There are 18 sections of that platform. Today, we're going to talk about Section 12, so we're two-thirds of the way through the platform. Section 12 of the WAGOP platform has to do with quality health care. And this is something that we as Republicans in Washington are committed to developing and delivering to the people of Washington. But we don't think that quality health care means big, flashy promises of free health care for everyone. On the contrary, we think we need to make our marketplace for healthcare services, medical services, more rational, more responsive to people's needs. You know, there's a big push on the left wing of the political spectrum to offer what they call Medicare for all, or free healthcare for everyone. And we've seen some of that in the struggling Affordable Care Act passed at the federal level that has created and expanded the Washington State Health Care Authority. But we've seen with the struggling Obamacare, ACA programs, that while they provide the name of health insurance or health coverage to people, they provide a plastic card to people. The plastic card doesn't actually get people good health care. It's an empty promise. And Washington Republicans want to move away from empty promises. We believe that the healthcare authority in our state needs to be reformed so that in implementing the Medicaid system, what we call Apple Care here in Washington, the healthcare authority does a better, more rational job of making real healthcare services available to people at a good, rational price. This is going to require a great deal of reform of how Apple Care works and of how the healthcare authority, the HCA, the state agency that implements Obamacare and Medicaid, how it operates too. It is an agency that is not terribly well run. And that's a testament to the outgoing Inslee administration and their general struggles being good managers. Beyond just the mechanics of delivering Medicaid and Apple Care to people and decent medical care within those programs, we also need to take a look philosophically at what quality health care for the people of Washington means. You know, the Hippocratic Oath, famous oath that every doctor takes, or at least they used to take, starts with the statement, first do no harm. That should be the guiding principle of any physician or medical professional. And we have allowed in Washington State the Healthcare Authority and our state-run apparatus of delivering medical services to be hijacked by political agendas that actually do harm. Obviously, this touches on some very hot-button controversial issues. The issue of so-called gender-affirming care and whether such care should be administered, those practices and those policies and those therapies should be delivered to minors, to children. We Washington Republicans believe they should not be. That basket of medical care, of services called gender-affirming care, should be reserved for adults who can make adult decisions about receiving those treatments. We believe that when you allow politics to inject itself into an essential service like medical care, you end up with the worst of both worlds, bad politics and bad medicine. So let's try to separate the political radicalism from the delivery of medical services. And we need to look too at how much we charge our Medicaid system, Apple Care, and the Healthcare Authority, that state agency that administers Apple Care, how much we require of that system, how much we ask it to do. We ask it to do too much, frankly. A lot of so-called homeless housing money is actually channeled through the Healthcare Authority and is spent in programs well intended that are supposed to help addicts beat their addictions, get on a healthier track, and get off the streets. Well, I mean, that's a good intention, but the mechanics of how it's done through the Healthcare Authority are not well managed at all. There's very little oversight of how that homeless housing money, that behavioral health, drug addiction money is spent going through the Healthcare Authority. We need to keep a much closer eye on how that money is spent. If we do that, if we return Apple Care and the Healthcare Authority to a more limited mission of delivering essential medical services to people in need, and if we remind the practitioners in that system, first, do no harm, I think we will do a much better job of getting quality health care to all Washingtonians. That's our goal as Washington State Republicans, and we are determined to take a more practical-minded approach to assuring the availability of quality health care for everyone. That's it for this week. That was section 12 of our party platform. We'll be back again next week to talk about other sections of that great document. Until then, stay strong and be well.